Greetings from New York, from the United Nations Statistics Division. Allow me to introduce myself. My name is Srđan Mrkić. I am the Chief of Demographic Statistics at the UN Statistics Division, and at the same time, I am the Technical Director of the 2020 World Programme on Population and Housing Censuses. It is indeed a pleasure and a privilege to be hosting this meeting as a follow-up to the first meeting that we have organized in February this year, trying to seize and document the impact of COVID-19 on census taking worldwide. For this follow-up meeting, we intend to use the difference between February and November to follow up on what is happening in the countries that undertook the censuses or are aiming to undertake the population and housing censuses despite the pandemic, and what other impacts the pandemic had as we are documenting a number of postponements in the conduct of the censuses worldwide. Let me then just lay out what we do intend to achieve with this meeting. The program of work that is in front of you is divided in 5 different sessions, and we really would like to go into details on each of these sessions regarding the national experiences and the different methodological solutions that have been employed for the purposes of ensuring that the census taking takes place as planned or as nearly as planned. So today we will be focusing, of course, on the opening and the introduction of the participants, followed by a very short presentation from UNSD about the state of the art of population housing censuses at this current moment. Then we will turn our attention to session number 3, the potential adjustments in census questionnaires. Given the fact that many 2020 round censuses have been conducted or will be conducted under the pressure of COVID-19 pandemic, population housing censuses could provide an opportunity to produce data on really quantifying the impact of this pandemic on the well-being of the population and the housing and living conditions. Here we are referring primarily to the impact it has on international and internal migration. As we all know, during the measures that have been introduced in a number of countries, the migratory cycles have been hugely disrupted, or in some cases even magnified by the movement of especially of the workforce from their usual place of working to the family homes. We want to see whether it is possible really to use the censuses in order to quantify this phenomenon and to make sure that this is something that will be reflected in the censuses as a kind of direct impact on the COVID-19. We are also documenting the huge impact that the pandemic has on how the census defines and measures the place of usual residence. And this is something that is also subject to the scrutiny in terms of the quality of data that will be collected with the 2020 round of censuses. And the changes of the respondent circumstances due to the pandemic, it might be necessary to provide additional guidance to support respondents in answering questions regarding the place of usual residence. And to do this, we have documented several countries that had to adjust their census instructions in order to better capture the actual place of usual residence that was disrupted because of the pandemic. And when we talk about these adjustments and the session number 3, we will also like to focus on the room for better analysis of the data that will be provided with the census is taking place this and next year, in order to make sure that, again, we do have sufficient understanding of the dynamics of the population and as well as the structure of the population and housing conditions. So this will be the goal for the session number 3. We will have the presentations from Ghana, Nepal, United Kingdom, and UNSD. I will just announce the other sessions. I will not go into details, at this point of time. I will introduce them as they come in order, but then we will focus on session 4, which is the major changes in census procedures to reduce the impact of the COVID-19 pandemic. Session number 5 focuses on assessment of the process quality and output quality for censuses conducted during the COVID-19 pandemic. Quality is of primary concern here, and the quality of the data and comparability with the previous censuses will be put on the table. And then session 6 will be focusing on effects of the COVID-19 pandemic on data analysis and comparability over time. Finally, session 7 will be discussing the conclusions and recommendations of this meeting. As far as the logistics are concerned, what we would suggest is, if you agree with this work program as it is, that we will be starting our sessions at 8 o'clock New York time, and we will be going maximum until 11 o'clock, so for a 3-hour session. Depending on the dynamics of the session, we may wish to take a break at some point, but we would not go beyond the 3-hour limit per day. If the session concludes earlier, then definitely we will be stopping there, because we want to maintain the order as it was submitted to you in the work program. So today we will be focusing on sessions 2 and 3. Tomorrow we will be focusing on session 4. The day after that we will be focusing on sessions 5 and 6 to finalize on Friday with the conclusions and recommendations. So I will stop here with introducing the program of work, and then I would ask whether there are any comments or suggestions regarding this proposed program. So the floor is open now. Very well, thank you very much. I would assume that the program of work has been adopted, as well as that you agree that UN Statistics Division will be chairing this meeting. It is a virtual meeting, as are all of these meetings in the case of pandemic, and this is something that is definitely unavoidable. We would have preferred to have all of you here in New York and at the UN headquarters and discussing this in person. Hopefully that will be happening next year. However, until the end of this year, all of our meetings will be strictly online. I would now suggest that we move to the introduction of the participants. We do have the countries that have submitted their participants here that were invited for this expert group meeting. We also do have a number of colleagues from all over the world that are logging in, and we welcome them all. And we will be very happy to, of course, entertain their comments and suggestions. However, I may not have all of them on my list, because we have almost 100 participants. So I would suggest that I would call on the country, and then I would appreciate the participants from that country to introduce themselves, switch off the camera perhaps, and then switch on the mic and introduce themselves, so that we know who is participating from, for example, Australia. So Australia, I will go by alphabetical order. Australia, would you please introduce your participants?
Hello, I am Therese Lawler from Australia. I am working as in the Program Management Office of the 2021 Census Program. We are joined by 2 colleagues, Georgia Chapman, who is the Program Manager of our field operations, and Peter Darby, who is from our demography area.
Thank you very much, Australia. Thank you and welcome. And I know that the time difference is not playing into your hands, so we appreciate very much you being with us. Bulgaria, please.
Hello, can you hear me?
Yes, quite well. Please go ahead.
Hello, everyone. My name is Magdalena Kostova. I'm working in the National Statistical Institute of Bulgaria. and I'm directly involved in the preparation and monitoring of application of census methodology in the country. Thank you.
Thank you very much, Ms. Kostova, and welcome to the expert group meeting. We are now moving closer to New York, Canada, please.
Good morning, everyone. My name is Jeff Bowlby. I'm the Director General responsible for the census in Canada. And I have with me my colleagues, Patrice Mathieu and Steve Treitz.
Hi, everybody.
Thank you very much. Thank you, Canada. China? Do we have China online? Very well, we will get back to China later on. Croatia? Moving to South America, Chile.
Hi, everybody. My name is Fernando Baez. I'm representing the National Institute for Chile, Statistics for Chile. And today we are Mendel and me representing our institution. Thank you so much.
Very well. Thank you very much and welcome. Ghana?
Hi, everyone. I'm Ousukeja. I happen to be the Chief Census Methodologist, so was in charge of the technical issues as far as the Ghana 2021 Population and Housing Census is concerned. And I'm here with my colleague, Godwin Odejebi, who happens to be one of the technical experts on migration. Thank you and over.
Thank you very much. Thank you and welcome. Hong Kong, please.
I'm Chris Lang from Hong Kong, China, and we just had our 2021 population census. And today I'm joined by my team members, Mr. Heng Tang, Mr. Ron Chen, and Mr. Alex Yu. We're all from the 2021 Census Office, and nice to meet you all.
Italy, thank you very much, Hong Kong. Welcome, Italy, Hong Kong, China, and then Italy. Do we have Italy? Let's move to India, please.
Good morning, everyone. I am Dr. Suchita Gupta from India. I am working as Deputy Registrar General in Office of Registrar General and Census Commissioner India, and I am joining this meeting along with our 4 colleagues, Rajat Kumar ji, Hemlata Sindura Varade ma'am, and Dhirendra. And we all are working as a census team here.
Thank you very much and welcome, India. Latvia.
Good evening. My name is Baiba Zukula. I'm Director of Social Statistics Department in Central Statistical Bureau of Latvia, and was involved in moving to register-based census from 2012.
Thank you very much. Thank you and welcome. Nepal.
Hello, good evening, everybody. My name is Kesav Kumar Gautam. I am working as a director in Central Bureau of Statistics in Kathmandu, Nepal. Myself and my colleague, who is also director in population section, Mr. Dundiraj Lamichhane, both are joining today in this program. We both are responsible for conducting 2021 population and housing census in Nepal. Thank you.
Thank you very much. And I'm glad, Mr. Gautam, that we can hear you now well and that everything is functioning properly. Thank you. Portugal?
Thank you.
Portugal? Saudi Arabia? Slovakia?
Hi everyone, my name is Chira Kishova.
And my name is Silvia Hudecová.
We are working on the Statistical Office of the Slovak Republic, on the Department of the Population Statistics, and on the Population and Housing Census 2021. And this is all. Thank you very much.
Thank you, Slovakia, and welcome. South Africa, please.
Good day, everyone. My name is Calvin Mulongwana. I'm the Acting Director General for Statistical Support and Informatics. I'm also responsible for the Population Census 2022, and with me I've got my colleague Nozipho Chabalala, who's the Acting Deputy Director General for Population and Social Statistics. Thank you.
Thank you very much. Thank you, South Africa, and welcome. Tajikistan. United Kingdom.
Yes, hello. My name is John Roth-Smith from Office of National Statistics for England and Wales, and my colleague Cal Gee is here as well from England and Wales. I don't think we have representation from Scotland and Northern Ireland, but we work very closely with them. And I work on the Census 2021 programme.
Thank you. Thank you, UK. United States.
Oops. Good morning. I'm Deb Stempowski. I'm the Director of Operations for the 2020 Decennial Census in the United States. And I don't believe any colleagues of mine are on the call this morning.
Very well. Thank you. Thank you, Mr. Stempowski, and welcome. Zambia. We are moving to our colleagues from regional statistical entities. The first would be GCC Stat, so the Gulf Cooperation Council Statistics, GCC Stat.
Yeah, thank you, Mr. This is Batul Obeid, social statistical expert in GCC Stat, with my colleague Isa Sheikh and Mr. Ali Lifleti. Thank you.
Thank you, GCC Stat, and welcome. ESCAP.
Hi, hello, this is Petra Nahmias from ESCAP Statistics Division. Thanks, Surgeon.
Thank you very much, Petra. ECLAC, please.
Yes, good morning, Fabiana del Popolo from the Chief of the Demographic Area and Information on Population. Thank you very much.
Thank you. UNECE. UNECA. UNESCO.
Hello, everyone. I'm Ismail Lubad from UNESCO. I'm responsible of the 2020 program of population and housing census and ISQA for Arab states. Thank you.
Thank you. Population Division, DESA.
Nice, Jen. Oh, Thomas, go first. Thomas, go.
Okay, good morning. Sorry, good morning, colleagues. I am Thomas, and we are also Stephen and Vladimira from the United Population Division. And I don't know if my colleagues want to say words.
No.
Thank you, Thomas.
Thank you. Thank you, colleagues. UNFPA.
Hello, good morning. This is Tapiwa Jamba from UNFPA headquarters. Thank you.
Very well. We do have on the list, and let me just read it, UNFPA. Aside from Mr. Jamba, we have Ms. Carrera Yepes, we have Ms. Pinuela, Mr. Fabian Ruiz Silva, Mr. Enrique Garcia Lopez, Mr. Carlos Hernandez, and Mr. Monteiro, but I also see here my colleague Edward Youngstra from UNFPA in Asia.
Yeah,
right?
I remained silent because Tapiwa was basically representing
Very well.
UNFPA. Thanks.
No, I just wanted to make sure that everyone understands the level of participation of UNFPA properly. World Bank, please.
Yes. Hi, good morning. My name is Bemisola Oseni, and I'm from the World Bank Development Data Group, and my colleague Olivier should be connecting shortly. Thank you.
Thank you very much, World Bank. I did see UNECA asking for the floor.
Yes, please. Good afternoon, everyone. I'm sorry, I'm having a problem with my camera. This is Gloria Matenge from UNECA, and I'm joining along with my colleague Andrew Mukulu. And I see my chief online, though he was not able to take the floor during our time. So thank you very much.
Thank you. Thank you, ECA. We have here Moldova asking for the floor. Please go ahead.
Hello, dear colleagues. Valentina Istrati from National Bureau of Statistics, and I'm joining the meeting together with my colleague Snigalita Nashko. Thank you.
Thank you very much, and welcome to the meeting. I have Sri Lanka. Please go ahead.
Good morning and good evening for all. I am Anoja Seneviratne, working as Additional Director General of the Department of Census and Statistics in Sri Lanka. I joined this meeting with my two colleagues, the Deputy Director, Mrs. Chandani Vijay Bandar, and Statistician, Mrs. Asanga De Silva. All of us are working together to implement the Census of Population and Housing in 2022. Thank you.
Thank you. Thank you. Thank you very much. I do have Melobogo Keragang, so please go ahead. You have to unmute yourself, Ms. Keragang, please.
I'm sorry. I'm Malebogwa Kerakang, the Botswana National Census Coordinator. I'm joined with Miss Grace Mpetolang and Miss Ruth Kautengwa. They're in the data management and ICT. And I'm also joined by Mr. Kwenahape Mokhosinyane and Mr. Tebogo Lalezang. They're with the field operations planning. Thank you very much.
Thank you very much. Welcome to the meeting. Let me just go through the text box messages and just read them so that we are all familiar with what they say. So we have from Naomi Copin from Good Morning Everyone, joining from Suriname. Naomi Copin, Acting Census Manager, Joanne Kenswick Fung, Aloy, Manager, Social Statistics Division, and Anne Sultan Beck, Head of Population Statistics. Thank you very much, Suriname. We have also Philippines on the meeting. Two of them are joining the meeting here. We have also Ms. Diana Beltadze from ESTAT. We have Montenegro, Snezana Remikovic is joining us from them. Then we have the U.S. Census Bureau International Program, which is from the U.S. From the United States, Nobuko Mizoguchi, and I have Aruba also here, Ms. Marjolene and Monique joining us from Aruba. So this will be just an overview. As you can see, we do have almost over 100 participants, and I believe that this number will even grew as we move on through the meeting itself. Welcome all. We are really extremely thrilled to have you all participating at this meeting, and we hope that not that we hope, but we're quite certain that it will be fruitful and a meeting that we can all draw some conclusions from comes Friday this week. So again, we will be working from 8 to up maximum to 11 o'clock New York time every day, and then we will have the conclusions and recommendations discussed on Friday. I will stop here and then ask if there are any comments or suggestions up to this point, either on the program of work or the logistics or any other issue that you may wish to raise at this point of time. So the floor is open before we move to the session number 2, which is monitoring the impact of COVID-19 pandemic and the state of the art of the census taking worldwide. So the floor is open. Please just raise your hand, or if you wish, you can use the chat box, whichever is more convenient to you. The floor is open. Very well, thank you very much. So I would conclude that the program of work, as suggested, has been adopted, that we did recognize the participants at this meeting, and that we will now move to the session number 2. And for this, allow me to share my screen for the first presentation, which will be by the UN Statistics Division. It is loading up, so just a few seconds until it finishes the upload. In the meantime, allow me to just recognize the participants that are now introducing themselves using the chat box. We do have Ms. Nadia Lakouf, Head of Population Census and Vital Statistics Division from Morocco. Then we have Indonesia. Akul Wajdi is joining the meeting as well. We also have introduction from Ms. Lina Maria Sanchez and Laura Granados from, joining us from Colombia. And then from Chile, we do have Mr. Fernando Andres Huernul. Welcome to all, and thank you very much for introducing yourselves. And we are really looking forward to learn more from all the participants as we move on through the meeting. Let me then try to put my presentation here. Can you see my presentation?
Yes, we can see, Sergio.
Very well. Let me then just start with briefing all of the participants on the work that has been done in the UN Statistics Division since the beginning of pandemic in trying to document the impact of the pandemic on census taking in the world. We did introduce a number of mechanisms trying to assess and quantifying the impact of census taking in order to provide two major outcomes. The first outcome is related to reporting to the United Nations Statistical Commission, which is the apex body of the international statistical system, on what is actually going on in the world when it comes to the population housing censuses, raising the alarm about the adverse impact that this has on the census taking and our colleagues that are trying to manage undertaking the census in unprecedented conditions. The second goal is to provide advice to countries, to colleagues, what are the best and contemporary approaches to be used in order to successfully conduct the census despite all of the measures that can be undertaken in the countries regarding mitigating the impact of the pandemic and the possibility of spreading of the virus. So with these two major goals to achieve, we undertook a number of mechanisms that we will be discussing here and then presenting it to you. By background, allow me just to point out to the 2020 World Population and Housing Census Program. It has been adopted by the Economic and Social Council in 2015. So it is a world program now adopted by one of the major bodies of the United Nations. And the World Population and Housing Census Program calls on all the countries to conduct at least one population and housing census, or to otherwise produce census-like small area statistics at least once in the period 2015-2024. This is just maintaining the sequence of the census decades, and every census decade starts with the year ending in 5 and ends in the year ending in 4. So this is the 2020 round that started in 2015 and is running all the way to the end of 2024. The program also calls on taking into account the international and regional recommendations in relation to conducting the population housing census, to pay special attention to advanced planning, cost efficiency, timely dissemination, and easy access to census results, set the quality standards for population housing censuses in terms of maintaining the integrity, reliability, accuracy, and the value of census statistics, and take into account the importance of the censuses for the 2030 Agenda for Sustainable Development. So here, let me just point to the fact that since the program has been adopted in 2015, and then the Agenda for Sustainable Development 3 years later, we are now essentially updating the principles and recommendations to reflect the impact on the censuses in monitoring the Agenda for Sustainable Development. I lost my screen. Frederick?
I'm not sure why. Yeah, we don't see it anymore.
Is anyone trying to share their screens at this point of time?
No, it doesn't appear anyone.
No? Okay, let me try again. Apologies for this. Then further on, the 2020 World Population Housing Census Program mandates UN Statistics Division to prepare international statistical standards, methods, and guidelines for the conduct of PHC, and we did that largely, and we are still doing it as we speak, focusing now on the register-based population housing censuses. We are also mandated to coordinate the activities among stakeholders in assisting member states to plan and carry out censuses, and to monitor and regularly report to the Statistical Commission on the implementation of this World Program. And what we essentially did, starting in March 2020, when the WHO, World Health Organization, declared COVID-19 a global pandemic, we did initiated a number of activities. And the first, we recognized the need to monitor the impact on COVID-19 on censuses, and we did conducted a survey. The first survey was launched in March 2020, so over almost a year and a half ago. It was then updated in September 2020, and then again in December 2020 and January 2021. So all of the results of this survey, according to the responses we have received from the countries, national statistical authorities, are available on our website, and they are organized in such a way that we can see how the decision-making process in terms of census taking took place in particular countries. And what we did notice from the outstart is that there are several major phenomena that were documented quite easily. The first, of course, is the urge to postpone the census until the pandemic passes, then to extend the enumeration period to completely unusual periods of time, unprecedented periods of time, which was the second reaction of countries, and then to try and to see some alternatives in terms to replace the face-to-face interviews, either with computers or with paper questionnaires. So these were the three major reactions that we have collected through this set of surveys. Together with our colleagues from UNFPA, we did issue a technical guidance note on the use of personal protection equipment for census taking. And this is something that was really needed at the time. It was in September last year, so over a year ago, when there were a number of questions coming from countries regarding the advice on the use of personal protection equipment, especially from the point of view that this has not been initially budgeted for census taking, and that indeed in a number of countries represented one of the major problems. Then we did have the first expert group meeting, as I mentioned, in February this year. The conclusions and recommendations, and I will mention just a few of them in the next slide, were presented to the Statistical Commission in March this year. Some of and then I will go back to them. You can find all of those recommendations and conclusions on our website. And what we are essentially trying to achieve with this meeting is to update those conclusions and recommendations so that they would have to be read side by side, not independently, but side by side, to provide a better understanding on the different angles and dimensions that this impact on the pandemic had on the census taking. Then we realized that we need something that is more up to date and more, let's say, in real time information that the international community can take advantage of. Therefore, we established a dashboard to monitor the impact of the COVID-19 pandemic, also on our website. So this is really updated as we receive the information from the countries. You can see from the just browsing through this dashboard the number of countries that are postponing the censuses, the number of countries that are delaying some of the census operations, and the other issues that are pertinent for the ultimate goal of undertaking a census. And then last month we did put together the UNDESA policy brief number 118, also available on the website. And this is like ringing the alarm bell to the broader audience that is being reached by the Department of Economic and Social Affairs policy briefs. These are mainly policymakers in the area of economic and social affairs of countries, and this is something that is of course customized to the audience, but however, you will see that the findings that we are presenting there are pertinent in all the circumstances. So this is just the recommendations on the use of the personal protection equipment together with our colleagues from UNFPA. We did recommend that the countries need to work with their health ministries. They need to develop a national guidance on recommended requirements for census in consultation with national health authorities and of course under the guidance of WHO. We also call on countries to review census operational and logistical planning and to implement social distancing measure and the use of PPE in all cases when there is a field enumeration involved in data collection for the censuses. Again, the issues that we are having here is that these costs were not initially budgeted in a number of censuses, and they become a kind of an obstacle in quite a few countries in terms of that postponing the census until that equipment became available and the funds for it. So that also had this the negative effect on the census taking. On the expert group meeting, as I mentioned, the first one took place in February. These are some of the main conclusions. All of them are available on the website that you can see in the last line. So many countries that plan to conduct their censuses in 2020 had to either postpone census activities or to extend the enumeration period and modify census procedure in response to the impact of the COVID-19 pandemic, with a number of them switching to online questionnaires in order to reduce direct contact with respondents. Conducting field enumeration under the pressure of COVID-19 pandemic has created concerns in terms of data quality, particularly on undercounting of the population. Building a well-designed quality assessment program is necessary to assess whether population censuses conducting during the pandemic are of reasonable good quality, taking into consideration the implication of using new technologies or procedures on the quality of census data. Another, and there are actually 2 pages of those conclusions and recommendations, but another that we believe is of particular interest for this meeting as well, refers to the fact that censuses conducted during the COVID-19 pandemic could potentially reveal trends, changes, and patterns. Although to what extent those trends and changes will be significant are yet to be seen at that moment. That was the conclusion. Such new trends, changes, and patterns will have implications for census data comparability over time. So as I mentioned, the first phenomena that we have documented were postponing the census. The second was extend the enumeration period, and third, try to use alternatives to the conventional door-to-door canvassing of the country using either tablet or paper questionnaires. Of course, the advice that we provided at the time was that any switch to an alternative methodology requires prolonged testing. It is expensive in order to the needs to maintain different methodologies for the for switching to the new and alternative methods, and then of course putting together 3 separate pieces, one for example for the internet enumeration, the second for paper self-enumeration, and the third one for example telephone enumeration, requires even more efforts and more resources than if only 1 or 2 were used. So we did voice the concern that switching too fast to the alternative methodologies may be problematic from the point of view of both the quality and the efficiency of the census operations. This is the dashboard also on our website, so you can see, of course, you can zoom in, you can zoom out, you can see for each country the replies that they are providing to us. We are asking the countries to do this as soon as they have the new information regarding the census, and then we are communicating with our counterparts, and many of you are here at the meeting with us to provide us with the information, and we are posting it immediately on this dashboard. So if there is an overview of what is going on in the world when it comes to conduct of the censuses, you will see that the green ones here, just for illustration purposes, are those that are concluded in terms of census taking. The orange ones are still pending, and you can see that majority of those are actually orange. This is the just the policy brief that I mentioned. The key messages that we put through this policy brief, and this is the link for it. The key messages are that the population housing censuses are not being carried out as they were planned before the pandemic. National authorities need to remain fully committed to conduct the censuses depending on national circumstances, and postponing census taking will have adverse impact on assessing the effects of national development policies due to the lack of granular census statistics in the 2020s. So what we are saying here essentially is that the countries need to maintain the census momentum, despite the fact that in most countries the censuses are postponed. There are difficulties, but the commitment to conduct the census at least once until 2024 has to remain one of the priority of all the governments. Otherwise, there will be no possibility of having the granular census-like small area statistics to assess the development policies, especially from the point of view of the SDGs, if you know how granular those requirements actually are. And then just few numbers here to illustrate the problem that we are facing right now, and this is also from the policy paper. Out of 110 national censuses for which data were available and that were scheduled before the pandemic to take place in 2020, 65% are either postponed or with unknown status, and 39 were conducted or are planned to be conducted by the end of 2020. Many of these 39 are actually register-based population and housing censuses. So this is the cause of alarm. This is the cause to raise the flag, and they say this is something that is happening. We really want to make sure that it is well known from the point of view of United Nations as an intergovernmental body, and we need to press the countries to really maintain the momentum regarding the commitment to conduct censuses again at least once until the end of the census decade 2020. Quite recently, we had the opportunity to participate at the CARICOM Committee on Population Housing Censuses. It was just 10 days ago, and you will see we have listened to this to them very carefully, and you will see that in this graph the number of countries that are postponing the censuses time and again is increasing, and you will see that only a portion of the countries actually was able, almost only 2 countries were able to conduct the census so far in the 2020 round. And again, we are talking about the Caribbean region, where you have the countries with rather smaller population and much easier to say undertake a census than elsewhere in a more populous countries. However, in the CARICOM situation, there are 2 components that influenced very much this current situation. The first one is, of course, the pandemic, the COVID-19, and then the inability of countries to adjust because of the requirements of lockouts and closing of all the unnecessary government services or non-essential government services. And the second is that most of these countries really rely on tourism as a major source of income. And then because of pandemic, the tourism did not, of course, provide that many inputs. And then it is reflected on the government budgets. So whatever was initially planned to be set aside for conducting the population housing census is now not available because simply there are no revenues coming from the tourism. So In the case of CARICOM, this is what we have learned, just as I said 10 days ago. But this is not unique, I would say, region. As you can see from the dashboard and from all the surveys that we conducted, this is something that is happening worldwide. And our goal is, again, to document this, and the second, to assess and to learn from countries that conducted the census, how they did it, and then to draw some of the conclusions and some of the advice that may be useful for all the other countries that are looking forward to conducting the census, hopefully next year or the year after that. We all know that with big calamities, you have a room for big opportunities. So we would really like to look at this both ways, to look at it as a calamity, look at it as really a problem that needs to be widely known. At the second time, we are also, on the second hand, we are also looking at this as a possibility of introduce some of the forward-looking solutions that will assist countries in really developing at least for the next round, the sound basis for conducting the census that will be as efficient as possible, and using different platforms in terms of statistical population registers, using administrative sources, and so on and so forth. So we are looking at the big picture. We are looking at the lessons that we are learning from the countries that are conducting the census under this pandemic, at the same time looking forward to a holistic approach, not only to population housing censuses, but also to the direct link with the civil registration, vital statistics, identity management, population registers, administrative records, and to look this in an interoperable manner that will then be a starting point for the countries for the next round of censuses. So this is what we have done so far, and this is all available on our website, and much more than this. Of course, you have the individual responses from countries. You do also have a set of presentations, very interesting and important presentations during the first meeting, and we are going to complement them with, of course, the presentations from this meeting, and therefore providing all the colleagues worldwide as much information as possible on what is going on and what we can learn from each other in the process of census taking in the 2020 round. So I will stop here. I will stop presenting, and then I will open the floor for any questions you might have regarding the presentation here. Please go ahead. The floor is open. Very well. Should you have any questions as we move on, please do not hesitate putting it into the chat box. We will address all the questions, either directly during the sessions themselves or after the sessions, then providing them in writing to the to colleagues. I will now stop here with the session number 1 and would switch with session number 2. Again, the session number 2 is focusing on the adjustments in census questionnaires. I mentioned already that the adjustment need to be made not only in the census questionnaires, but also in the instructions on how to define some of the usually easily to define categories, such as the place of usual residence, or the place of work, or the place of education. But this all definitely has been impacted by what happened in the with the measures that the governments introduced to mitigate the impact of the pandemic. So here we will be having the presentations from our colleague from Ghana, from Nepal, from United Kingdom, and UNSD. So what I would suggest is that we start with Ghana and Nepal, then we will stop and open the floor for discussion on these two presentations, and then we will proceed with UK and UNSD, and then again open the floor for discussion. So if you agree with this, allow me just to then stop sharing the my screen, and then proceed with our colleagues from Ghana. Okay, Predrag, I think I need some help with this one. Can you?
Yes.
Okay, please do that, and then. So Ghana, you have the floor. If you can start sharing your screen and then proceed with the presentations, please go ahead.
Okay, trying to assess my okay. Can my screen be seen, please?
Hi, yes, we can see your screen.
Yeah, I should put it here. Right.
Your slide. Perfect.
Okay. Thank you so much for this opportunity. And as I indicated, I'm here with my colleague Godwin, who is one of the technical experts supported in the conduct of the Ghana 2021 population and housing census. And so, an outline, we'll look at just a brief introduction, and then we'll go into the anticipated challenges due to the COVID, and to talk about the kind of changes that were undertaken during the 2021 population and housing census plans. And then we will share our thoughts on potential adjustment to census questions due to the COVID. And so for the Ghana 2021 population and housing census, the overarching goal of the census was to have complete coverage and quality census data. So this is what guided our thoughts as we implemented the census, having complete coverage and also having the quality of the data, especially having in mind the fact that this was the first time that we were doing a digital census. And so for the initial plans, we had our cartographic mapping, and that was to subdivide the country into smaller enumeration areas to make sure that we assign enumerators and supervisors to these demarcated areas. Fortunately for us, at the time that COVID reared its head, we had completed the cartographic mapping, and so that did not have any effect on us. However, just after the cartographic mapping was when we had the COVID. And so we in Ghana recorded the first COVID case in March 2020.
Mr. Kagia,
Yes,
Kagia, we are still on just the first slide. Are you moving your slides or are you still with the first slide?
Yeah, on the first.
Oh, okay, please go ahead. My apologies.
Okay. Right, thanks. Yeah, so we as I indicated, after the cartographic mapping was when we had the first COVID case in Ghana in March. And so that was when we were really into the recruitment, the training. Training was in different levels, 4 levels of training. And so we had started training of some of the officers. And then we realized that because of the COVID and the fact that we're not too sure when we're going to conduct the census, we had to modify the procedures. And so in particularly training, we had to, in addition to in-person trainings, had to add online training. And then we also realized that it was going to affect the duration of the training and data collection. And then we had to also make sure that we work around the method of enumeration as the COVID was going to affect us. And so for some of the anticipated challenges, we talk about the information that we collected during the census. And for us, per the law, we were supposed to gazette our instruments months ahead of the main data collection start. And so we did not make any change in the instruments as a result of the COVID. So we stuck to the instrument that we had already developed, even though we had postponed the census. And for those of you who are not aware, Ghana was to conduct the census in 2020. That was in March, but then we conducted it in June this year. And so as I indicated, no change in the instrument was made as far as the amount of information to be collected was concerned. But then we realized that we will have some kind of challenge in terms of the measurement of the periodicity, talking about the 10-year period, we miss it. And so we're going to have a shift in the census year. And then also the census night, which we had already planned in March 15th of 2020, had to be rescheduled to June 27th. And so the other concern also had to do with the period within which we conducted the census was rainy season. And so the concern was how the rainy season was not going to affect the data collection exercise. And so we anticipated that because of the COVID and the way people were responding to the issues, we realized that it could affect response rates, and therefore a lot of activities and procedures were conducted to make sure that we minimize the effects of this. And so we quickly had to work around our budget to make sure that we get PPEs for all the people who will be involved in the census activities, including enumerators and supervisors who were going to collect the data for us. And so that affected our budget because initially we hadn't planned purchasing PPEs. And then also during the training, we also had to make sure that we maintain the social distance, washing of hands, buying of sanitizers and all that. And also within the public space, we made a lot of noise to kind of make people aware of the importance of the census so that we don't focus so much of our attention on the pandemic. And so a lot of noise through publicity, advocacy, and education was done to make sure that we do that. And so we did, in terms of the method of data collection, we did in-person protocols, and as I indicated, wearing of masks and having social distance between enumerators and respondents were some of the things that we really emphasized during the training of enumerators and supervisors. And at the data collection point, we had some enumerators who, a few of them who were told, visited homes were not wearing masks, and respondents sacked them so that they go back and wear these masks. And so it actually had a positive effect on what we were doing. Because of the COVID, again, we had to, as I indicated, vary the way we trained. And so in addition to the face-to-face training that we usually do, we had to make sure that we also use virtual training and also introduce what we refer to as self-learning. And so what we did was to share all the documents with the prospective enumerators and supervisors so that they read the documents ahead of time, and if they had questions, they will ask ahead of time to make sure that they get some kind of understanding before the face-to-face meeting. And we also had to even vary the number of people that we put in the classrooms. So initially we had planned to put 50 participants in the classroom, but because of the COVID, we revised that to 40 maximum in a classroom. And as I said, publicity for the public was heightened, and consultation with stakeholders via webinars, consulting other people, other key stakeholders through webinars and all that were implemented. Talking about having technical meetings with our colleagues within the regions and the districts, we had to resort to virtual means to make sure that we minimize face-to-face contact and all that. And so, as I indicated, we did not change, make any adjustments in our census questions, but our proposal is that if there's going to be any adjustment, then these are some of the areas that, as technical persons, we need to look into. So we talk about the age, we talk about the fertility. So these are models that we had in our questionnaire. And so we had fertility as a model, we had mortality, we had migration, immigration, economic activities, and literacy and education. And these are the areas that we propose that we look at carefully if you want to make any adjustments. For instance, if you take age, we think that unlike previously, in our censuses, we were asking about the age that respondents had attained. But this time around, what we did was to get a question that is asking about the actual date of birth. And so,
Mr.
Kage,
Kage,
yes.
Mr. Kage, sorry to interrupt you one more time, but the colleagues are asking whether the slides should be moving or not. You are still
moving. I'm on my last slide.
Well, they were not moving at all. We are still on the
Really?
first. We are still on the first slide.
That is too bad. I'm on my last slide.
Can you move them?
Can't see it moving.
Perhaps if they are in slideshow mode, they can move, yeah?
So you cannot.
Now?
No, they're not moving. Now it's moving.
Wow.
Only now. It's slide number 3 that we are seeing right now.
No, this is slide number 8. I'm showing slide number 8, which is the last slide.
Oh, okay. Very well. We will have the opportunity to share this with the. This is unfortunate, really. I thought that at the very beginning, as I mentioned, that we were still on the first slide, but very well. Please go ahead, please.
Okay. But I had earlier shared my slide, and so that could also be shared with participants.
Yes, definitely. Thank you.
Okay, thank you. So so I was talking about the age, and I was indicating that it is very important to ask the specific age of the respondents. That way, we will be able to determine the actual period within which the individuals were born, for instance. Particularly if you want to track how many people were born within the COVID period and to make some interesting analysis out of that, then getting the actual ages will be helpful. The same applies to the fertility model and mortality. And so mortality, we're asking about deaths that had occurred within the household within the last 12 months. And so if we actually get the date, the actual date of death of these household members, then it will be helpful to know when the deaths actually occurred. And if you want to add some more questions to even find out what actually was the cause of the death. We asked that question, the cause of the death, but we did not go into details as to whether it was COVID that was the culprit or some other. But then our interest was on maternal related deaths, and so we did not go into so much of that detail. When it comes to internal migration and immigration, I think that the proposal is that, yes, when we ask about when the actual period within when the movement took place, then we'll be able to make a good kind of analysis as to the movement patterns of people within the COVID period and all that. On the economic activity questions, how we are asking the question is the activity that people engage in within the last 7 days. And so, and that because we are using the de facto method of count, the 7 days is in relation to the census night, the 27th June. And so it will not give you a sense of what activity that people were even engaging during the COVID period, and if there's going to be any support on that, it will be very difficult to. And so our thinking is that if there's going to be any adjustment to the census questions to be sure of how the COVID had an impact, we think that the reference period should not be like what Ghana used, making reference to the 7 days preceding the census night. And the same applies to school attendance. we're looking at how many of our people has ever attended school, either attending school now or had attended in the past, or whether they have not attended school at all. And this is so broad and will not tell us anything about the effect of the COVID. And so these are areas that we feel that if we want to actually assess the effect of the pandemic, then some kind of adjustment could be made to make sure that we elicit that information. Thank you very much. And I will stand by for any questions and clarifications. Thank you very much.
Thank you very much, Mr. Kagia. Let me just point out to all the participants that we intend to upload all the presentations, unless, of course, the presenters have any objections. We will upload the recording of the session and the presentations in the afternoon New York time on the day where the session took place. So that means that the recording of this session, again, unless we hear from any of the presenters any objections of putting the recording up, it will be posted this afternoon New York Times together with all the presentations, and this will be on our website for this meeting. So you will have access to both, and then you can digest at your leisure the proceedings of that day. So with this, again, thank you very much, Ghana. We will move to the second presentation before we open the floor for discussion and follow-ups. Nepal, would you please take the floor and share your screen?
Sophia. Is it okay?
Yes, it is.
Nepal,
Hello, good evening.
could you please put your presentation in slideshow mode so that you can easily move the slides?
Hello, good evening, everybody. First of all, I would like to thank UNSD for giving us this opportunity to share our experiences. Today, me, Keshav Kumar Gautam, and Dhundiraj Lamichane, two working in the population section of Central Bureau of Statistics, are joining this program, and we are presenting this slides jointly. Let us discuss on the first slide. First of all, I would like to give some brief summary on Nepal's population census. This is the 12th census in period of 110 years in the history of population census in Nepal. This year, we are roughly enumerating 30 million people in 7 million households.
Mr. Gautam.
Yes, please.
Unfortunately, the slides are not moving. We are still on the first slide.
Oh, what happened? I don't know. I am. Is it moving now?
No.
No. What happened then?
Put it in slide mode, please.
Sorry?
If you can put it on slide mode, it might move easier.
Yeah, it's in slideshow mode.
Okay, we are now at slide number 4. That's what we
it
are
moving
seeing,
now?
right? Yes,
Is it
now
moving
it's
now?
now
Okay.
it's on slide
Okay,
number 4. But you
Okay,
should
thank
be
you.
on number 2, right?
Yeah, I'm on number 2.
So if you can move to number 2.
Thank you. Thank you. This is the number 2 slide.
It's not, we are seeing the slide number 4.
How about now? It's the first one. This is the second one.
Yes, what we are seeing, we are not seeing. That's the problem. You see,
what happened then? The same thing was happening in the first session as well.
The same thing, yes, obviously.
Yeah, I don't know what happened.
Perhaps if you can use the left panel and click on the slide itself, that would help.
Can we control this? Do we have the copy of the presentation?
Yeah, why not? Okay, please.
Safe, do we have a copy?
Yes, we do.
Yeah,
okay, so,
I have already sent it to you.
Okay, so we will run it and then it will take us to move from side to side. Is that okay, Mr. Gautam?
Okay, please go on the second slide, please.
Okay. Safe, Predrag, can you please just upload and then follow the...
I don't know what happened then.
That's all right. Something obviously is not compatible, but then we will try to resolve it.
Safe, do you want me to try to share or you want to share?
I need to stop sharing first?
Go ahead.
Or you control from there?
Just a second, Mr. Gautam. Let us upload the presentation.
Okay.
Just a few seconds.
I have it, unfortunately, only in PDF format.
Okay, that will do. So we are now on slide number 2, Mr. Gautam. So please go ahead.
Yes, please.
Can you see the slide yourself?
Mr. Gautam, can you see the slide I'm sharing?
I see, but it's not in full screen mode.
It's not. Okay. We will use it like this, but that will do the job.
Okay. I can see in full screen mode. Thank you.
Yeah.
Thank you.
Okay. Please go ahead now.
So I was talking about brief summary on Nepal's population census. This is the 12th series of the population census in Nepal. We are enumerating 30 million people in 7 million households, roughly. This the 12th series. This is actually incorporated case. So we are just getting building structures, number of stories, main use of buildings in every that are built in Nepal. We have a
Mr. Gautam, we lost you. We cannot hear you any longer. Mr. Gautam?
I'm sorry, I was disconnected for some time.
Okay, so now we can hear you well. Please go ahead.
Okay, so actually Nepal census actually contains 3 census in it. One is building census, another is livestock census, and another is population census. So we call it population and housing census. And we are using 3 methods of data collection. One is paper-based model, another is CAPI model. We are using a limited number of tablet in capital city, metropolis, and similarly we are using diplomatic missions abroad. We are using using e-census method, in which we have designed a web application, and on that we will collect the individual information from all diplomatic missions abroad. So we are using three different data collection means in this census. Please go to the next slide, please. Please go to the next slide. Can you hear me?
Yes, I think I'm on the next slide on human resources.
Okay, now fine. Thank you. Now, on human resources part, we are nearly using 9,000 field supervisors, 39,000 enumerators, and those field supervisors enumerators are the fresh the people who do not have any, in another terms, they are called unemployed youths, and we are using them by the recommendation of our last census. We'll be just training them, and we have trained about 1,700 provincial master trainers, and those master trainers have been selected from secondary schools in Nepal who are teaching in secondary schools, and we have provided them master training in different sessions so that they can instruct in all our training sessions. Similarly, we have about 500 district level and area level census managers, and who also work as trainers in our district as well as local level training. Similarly, in our 17 administrative districts of the country, we have opened 87 district census offices, and similarly 349 local census offices. And regarding the steering committee, we have one steering committee that is at the central level, which is chaired by Vice Chairman of National Planning Commission, and the lowest committee is the area level committee that is chaired by the ward chairman of our smallest administrative area of our country. So from national level to local level, we have different steering and coordination census coordination committee who will just in one way they steer the policies in the national level to the implementation at the field level. Please next please. Next please. Next please.
Sorry, there's a bit of delay in the. I hope you see it.
Not a problem. Okay. So our census was originally planned to be completed on 22nd of June. That was the last enumeration day of the census. That is the usual census day in our country as well. But due to the COVID, we had to postpone our census work by about 5 months. So when the training was being conducted, supervisors training was being conducted, government just postponed all the census activity. That was on 4th of May 2022. By that time, we had conducted 5 training days out of the 7 days. So we have to just abruptly postpone every census activities, including the training and other communication as well. So it was in fact impossible to continue training at that time because government had announced lockdown in various parts of the country, and it was very difficult for those training participants to come and join the training, and after the training go to the field and enumerate the households. That was stop all those activities. But fortunately, after the COVID cases subsided, the government again announced the new date for census, and that is September 15 to October 4 for household listing activities that has already been completed, and November 11 to 25 that is for main enumeration. I'm sorry, the upper one, September 15 to October 4 is 20 days, and the lower one is 15 days. It's the other way have been written here. I'm sorry for this. Please go to the other slide, please. So, due to the uncertainty in resumption of the census activities, the newly established local census offices were forced to be kept in standby position, which resulted a cost overrun for about 5 months. As I have already mentioned, we are just doing the resuming the census activities after 5 months. So this is the unnecessary cost overrun for our country, because everything was sent to the field, and all those local census offices, those need to be kept in standby mode, for which we have to more. Similar models, which were audio, video messages, short video, pamphlet, poster, brochure, etc., all those become outdated in as regards to the new date. So we have to correct all those dates for which we need extra money. Similarly, as we just abruptly postponed the training on the 5th day of it, so those supervisors already selected, those dropped out when we resume the census activities. So about 5% dropout was there in the recruited supervisors number. And
Mr. Gautam, it appears that we lost you again.
Hello.
Mr. Gautam, yes, we can hear you now. Please go ahead.
I'm very sorry.
That's perfectly fine. Please, that's all right. Please go ahead.
So similarly, the other thing that cost much for the census was due to the pandemic. We had to expend money on face masks, seal, and face shield, and as well as hand sanitizers, all those things. So those COVID prevention, those logistics, those were procured and fortunately, those things were just supplied by UNFPA to us, and we are using those COVID prevention, those PPE, in our new enumeration, in our enumeration as well. Similarly, the main effect due to the COVID was procurement of the laptops. Actually, our vendor did not deliver those in time, just citing the global shortage of the laptop due to pandemic. But they have given strong commitment to supply the laptops by the end of this new enumeration date. But if in case they are unable to deliver, this may delay data processing and hence the publication of the census results. So another effect due to COVID is as the COVID has affected many lives and their livelihoods as well. So some households have relocated their original residences. So in case they have relocated their residences, those will be counted from the new residences if they usually reside there. But if they return and they return to the original place, then we enumerate them from their original place. So due to this, there may be some change in pattern accordingly due to the this change in usual place of residence. So we may have a hard time to compare the before COVID and after COVID census results. I mean, the results from last census. So we need to be very careful while just publishing the results of this census, as this has been affected by the COVID. So what we will do is we will try to validate those new results from other sources, but there is much problem in Nepal that our other administrative data system as well as other statistical data keeping system is not very robust. So we may not have other comparable figures to validate those census results. So as due to the lack of other record keeping system, other administrative statistical system in Nepal, there is much load in Nepal's census. That's why Nepal's questionnaire may be the largest one in the world, I guess. We have to cater different demands from different stakeholders, and all those demand the information to be brought from the census. Please, the next one, please. So, so what we have done is, if there is under coverage of population due to this change in residences, we have set up online telephone drop-in services as well as we have prepared one web application so that people can just notify whether they have been missed, whether our enumerators have not reached their home. Then we will make some special provision to enumerate them by any means. So regarding the participation in census as well as regarding the the protection from COVID and collecting data amid this pandemic, we have used different diversified communication channels to encourage respondents to participate, as well as just to protect from COVID as well, just keeping physical distance and using mask and using face shield, using hand sanitizer as well. And we have instructed our enumerators to not contact physically not to go very near to the respondents while collecting the information. So these are the all measures taken by enumerators as well as the respondents to just protect from COVID. So in the summary, this COVID has affected our census. This has delayed census by about 5 months, but fortunately we have been now successful to implement it. Today is the last day of our enumerators training, 4 days training. So after 1 week, we will be sending the field. So our main enumeration date is November 11 to November 25. That is will be there. And after 1 week in the field, and we have just established all those support systems for monitoring of those field work, and everything is ready now. So this is my presentation. Thank you for listening, everybody. Okay, over to you, please.
Thank you very much, Nepal. Mr. Gautam, thank you very much for this overview, and at the same time, congratulations for the being able to still tackle the census activities despite all of the difficulties and the delays and the additional funds. And we do hope that the enumeration itself that is going to take place later this month will be successful as well. I will now open the floor for any kind of questions or follow-ups that we might have. We will collect 2 or 3, and then we will ask the presenters from Ghana and Nepal to address them. For Nepal, there is already one question, which is related to the definitions of usual residence. And the question is from Sri Lanka. What did you adjust the question on usual residence to actually reflect the difficulties that you were describing when it comes to where people actually live? So the question is, did you adjust the instructions for enumerating the place of usual residence? And if you did, how did you do it? So that is the first question for Nepal that I picked up from the chat box. I am now opening the floor. Please raise your hand, and then we will then follow up with the question. I have a question from Asalfiu. Would you please introduce yourself first, and then ask your question?
Thank you. My name is Asalfiu Obera. Are you hearing me?
Yes, we are hearing you.
I'm the Census Director of Ethiopian Central Statistics Agency. My question for the Nepal is, I have seen a 3 method of data collection, that is paper, copy, and the online. So how the management of this data collection can be done? I thank you.
The management in terms of, I believe that the presentation of Nepal clearly distinguished that the paper questionnaires will be used for the majority of country, the tablets only in urban areas, and then e-census for diplomatic representatives abroad. But then we have your question, so Mr. Gautam will address it. The floor is still open. Please go ahead. Any question for Ghana or Nepal? Yes, Nosifo Shabalala, please go ahead, introduce yourself.
Thank you and greetings, Nosifo from South Africa. My input is with regards to the suggestion that was made by Ghana regarding the modification of the age variable also in the fertility and mortality sections of the questionnaire, suggesting that instead of asking the age in completed years, we ask the date of birth. I think we may experience challenges in instances where we ask a proxy respondent to report on fellow household members. Sometimes a proxy respondent may know the age, but not the exact date of birth. So just thinking, how can we deal with this to avoid high item non-response on this variable? In South Africa, we ask both currently. Recently, we've just had a question from one of the stakeholders to say, how do we accommodate people or respondents that would not want to divulge their age? Maybe they will want to talk about the age category as well. So it's just a question, maybe not only to Ghana, but for discussion. How do we deal with this and the possible high item non-response rate on this variable? Thank you.
Thank you very much. Yes, this is a very definitely important point that we need to actually discuss and then provide some kind of experiences that were collected in as many countries as we can, so that we understand what might be a good solution for avoiding errors and for avoiding the non-response. Any other questions for either Ghana or Nepal, please? I do have a question for Ghana. If I may, when do you expect to have the processing of the data accomplished? And do you, number one, number two, did you conduct the post-enumeration survey? Or do you plan to conduct the post-enumeration survey? And number three, what kind of quality assurance analysis you will undertake once you have your data processed? So for Ghana, those three questions. Any other question before we give the floor to Ghana and Nepal? Yes, I have Pushkal Orgi. Please introduce yourself.
Yeah, sir, I'm Rushali from ORG, India. And my question is to Nepal. It's not related to pandemic, but just I want to ask whether for Nepal, they're counting population in some areas, particularly in border areas, by using a drone system, camera drone or something like that.
Whether they're using aerial imagery for the purposes of the census using drones. Very well, thank you. So we have that question for Nepal. Let's give the opportunity to our presenters to address those questions. So Ghana, please go ahead. So there is a question from South Africa regarding the difficulties that you have in collecting the exact date of birth for the fertility model and the date of death for the mortality model. And then there are the three questions coming from my side regarding the quality control post-enumeration survey and the date of releasing the results. Please go ahead.
Thank you very much, and for these important questions as well. Yes, so South Africa, thank you. This is one of the difficult areas when it comes to collecting data on age, especially for people who don't know their date births. And so you are right. But in our case, what we do is that we also prepare what we call calendar of events for the enumerators and supervisors. And so there are some events that usually will help the respondents to remember their ages. And so as part of the training, we have cataloged a number of events in terms of calendar, so that when people are unable to tell their exact ages, we probe further using some of these events to help them to be able to let us get something very close to the actual date of birth. In a few of the instances, yes, we are still unable to give us something using the calendar of event. And so in that instance, we leave it as that. And so in the data, what we tell them to do is to be able to just determine use the year, how old they are to determine the year. And so, but those are in the minority, but largely for those who are unable to tell the date of birth, they are able to use the calendar of events to determine that. And in doing that, we also check on the age misreporting. So with the tool, we are able to assure the quality of the information that we are getting from here. On the question of when we are getting the data processing done, what I will say is that it's ongoing. Already we have released 2 reports from our census. The first was the release of the preliminary reports. That was 22nd of last month. And this month, 19th, we released another report, which is proximity to essential services report from that. And on the 15th of this month, we are also planning to come out with the final figures and also get information on all the variables that we got from the census. And so that is the plan. And concerning the quality assurances, let me say that we had a number of inbuilt quality checks within the CAPI application. And so a number of them, as we try to elicit the information, try to draw our attention to some of the errors as we pick the information. And then also, aside this, we developed a document, which is the edit specification handbook. And so this was done with the data processing team. So I'm talking about the technical team coming together with the data processing team. And we all sat down to develop some of these edit specs to help in the processing of the data to make sure that we get the quality that we need. On the PES, yes, we conducted post-enumeration survey, and this was, I think, a month or so after the field data collection was when we started field work for training, either the training of the first staff for the post-enumeration survey. As we speak now, the team that conducted the post-enumeration survey have been able to match the survey information with the census information. And so the proportion of the information that could not be matched is now going to be validated in the field. And so that is the stage where we are. And I'm sure within the next few weeks, they should be able to finish with that activity to make sure that we get our census validated with that information. Thank you very much.
Thank you very much, Ghana. Thank you for the answers. Turning to Nepal, please. Nepal, you did have 3 questions addressed to you. So adjustment of the instructions for usual residents, the the three modes and their application, and then the use of aerial photography and drones for assessing the population in remote areas. So please go ahead.
Hello?
Yes, we can hear you well. Please go ahead.
Thank you for the queries. First of all, I would like to respond to Sri Lanka regarding the adjustments of definition of usual place of residence amid COVID pandemic. Actually, we did not adjust any definitions due to the change in usual place of residence regarding the COVID. Actually, what we thought is that if there is permanent change in the usual place of residence, then that should be reflected in the new population census, that is the new pattern. In case of the permanent change in place of usual place of residence, we need to reflect that in the census. But for temporary usual place of residence change, what we have done is usually that this temporary change is for those households who are residing in rented households. So those rented households, or maybe some permanent households as well, they may have changed their place of residence. But what we thought is if they return the date of the census, then they will be enumerated in their new place. So we did not have any adjustments. But what we want to do is conduct post-enumeration survey. We try to assess whether any households has been missed from our counting. If we find significant number of households that have been missed from counting, probably we may plan some kind of post-survey to gauge those missing, and probably we may adjust those figures. But this is not sure now. Now, regarding the second questions on different methodology, we have CAPI, paper, as well as e-census. And in most of the country, we are administering paper-based. Those e-census and CAPI are on very limited scale. And regarding the other questions from India, actually using the drone that can enumerate only buildings or just physical structures, or maybe that may be used in agricultural census, or maybe in forestry census, or some kind of area census. But counting the population by drone, this is not very useful, I think, because how can we just enumerate individuals using the drone? So this is, I think, not true that we are using drone. Even in border areas as well as in very remote areas, everywhere we send our enumerators to enumerate people. So that's all from my side.
Thank you very much. Thank you, Mr. Gautam, and thank you, Nepal. This was really very clear. We will now move on to the remaining two presentations under this session. I give the floor now to UK. Would you please share your screen and go ahead?
You just bear with me a moment. I put that on. Can I just check, is that visible?
Yes, it is visible. And now let us see whether you can move your slides before we start.
No truth, bear with me. Did that work?
It's working. Yes, please go ahead. Thank you, Jonathan.
Smashing. So I'm John Rothsmith, and I'm a statistician working on the 2021 census. talking about England and Wales specifically. The census in Scotland has been delayed until 2022, and the other parts of the United Kingdom, Northern Ireland, also conducted the census this year. So, yeah, as I say, the census in England and Wales took place in March this year during the pandemic. Probably fair to say, useful to say that we were really pleased with the return rate we achieved, around 97%. And we were really successful as well in terms of online completion. So people, households that completed their census returns online was around 89%, which is significantly higher than our expectations. Because we recognised that the potential impact the pandemic could have, we undertook an analysis prior to the census to understand which questions were likely to be impacted, and where we could or should provide additional guidance or changes to the question ahead of the event. And the objective of this exercise were, as I've got stated here, we wanted to really minimise that respondent burden, so make it as easy as or clear as possible for the respondent to complete their census return, reduce the impact on the call centre where there's uncertainty. So clearly, if people have questions, etc., they would phone up the contact centre. We wanted to minimise that if they were unsure. Eliminate inconsistencies in how people interpret the questions. So we didn't want people to just do what they thought was right. We wanted to understand that data that we were going to collect and how it related to user need. And we also wanted to make sure that our learning was going to be applicable to other ONS, Office for National Statistics, surveys, so our social surveys, business surveys, etc. And one thing I would say is that in terms of when we talked to users about this, there was a feeling that they would like to understand what that new normal looked like, but they were aware that this wouldn't exist by March 2021. So therefore, they were content for the census to capture the current circumstances, and that was one of the kind of guiding principles that we kept in mind. So I'm going to go a huge amount of discussion around what wasn't impacted. These probably won't be a surprise. So in terms of both households and individuals, and I've got these listed here. We did recognise that there'd be some elements where there could be a small minor impact. So tenure, number of cars, number of bedrooms, individual questions, intention to stay, main language passports. I was going to focus more on where there was a larger potential impact, and I will try and touch on a couple of the questions that have already been asked. So these are the areas that we thought that the potential could be larger. So who usually lives here in terms of the usual residence question, second addresses, so whether people spend time at a second address and whether they're completing at that second address or at their usual residence, students' term time address, as we recognise the university sector was particularly impacted, usual address 1 year ago, labour market and travel to work, which I'll say a bit more drill downs, a bit more detail later, and then the number of visitors who are staying at that address. So in terms of their name, sex, date of birth, usual address, and then obviously in terms of things like health reporting. So the approach that we took to before we made any changes or changes to our guidance or around the questionnaire was to, as you would expect, to thoroughly question test it. And we had quite a comprehensive suite of testing regimes to understand before we implemented any changes to any census questions themselves, to thoroughly test those and make sure that we had a good understanding of how people were going to be able to respond. So we went through a very late extra phase of question testing to get people in different circumstances to answer questions and make sure that they were understood for those current circumstances. So we tested the questions thoroughly and the additional guidance thoroughly. The changes that we made were relatively easy to make to our electronic questionnaire, which we refer to as EQ, so that online means. But it wasn't possible to make changes to the paper questionnaires themselves, as you guys were all well aware. The printing took place well in advance, and we were very conscious of the risk of implementing changes which had been thoroughly tested, because we were aware that there could be unintended consequences of those extra steps that we were making. In addition to clarification within EQ, we did make changes to the supporting guidance that went alongside those paper questionnaires to provide clarification. And this included information for the contact centre and information which was available through our field staff on the doorstep. So I hope you can see this okay. So in terms of the changes that we made to our electronic questionnaire, we made changes by providing 2 additional screens, and I'll go through that in a moment, and then 9 additional pieces of questionnaire guidance which we inserted around the questions themselves, to be clear that we were asking about the current context, with the exception of, we also made a slight change to the address 1 year ago guidance box, but that was already backward looking. So I said we added 2 extra screens. I won't go through all of the examples here, all the 2 additional screens and the 9 additional pieces of guidance, but this first, on the left-hand side, this is the first screen, additional screen that we had, which just flashed up, just to be clear that in the context of the pandemic, that we recognise that circumstances may have changed, and that we're asking people to respond based on the situation as it is now. So that was a sort of high level page, which people clicked through. On the individual questions, I said there were 9 questions where we provided additional guidance, and this is an example. There's a couple more later on. So with that question, do you mainly work in the UK? We added an extra red box, and that did say clearly that if the pandemic has affected where you mainly work, select the answer that best describes your current circumstances. So the question itself doesn't change, but the extra guidance around it just provides that clarity. And here are a couple of other examples. In your main job, how many hours a week do you usually work? And then the extra guidance there is, if the pandemic has affected your working hours, select the answer that best describes your current circumstances. And again, the question doesn't change, but we just be clearer about what the how we wanted people to answer the question. We were quite regularly asked and continue to be asked about travel to work because of the clear impact that had on the pandemic. And we've got that extra red box here as well. So if the pandemic affected your travel to work, select the answer that best describes your current circumstances. And I think you can see here that if we try to do something different to that and say, what would it normally have been like, or what do you expect it to be like, the amount of different interpretation risks provided a real risk to data quality and our understanding of what we actually collected. Those were the changes that we made to around the questionnaire itself, but we also made changes to, as I said before, the published supporting material and comms, the information that was provided by the contact centre and that was available through online help, and then also the material and training that was provided to our field staff when they were following up non-response, to be able to provide extra guidance if respondents had questions. And I've got here on the right-hand side an example of our online help. It's just a screenshot, a small area of that page. How do you usually travel to work? And then we added that extra box that said, if you're currently working, the pandemic has affected how you travel to work, select the answer that best describes your current circumstance. So if people wanted to look that guidance up, they could, and that would be providing an additional steer. A couple of the points that have been made so far in the other presentations were around usual residence. And we did provide some specific guidance around other topics where we didn't change the questionnaire. So, for example, for students, we clarified that we were asking respondents to complete at their term time address, and we changed our online help. We did additional guidance directly through universities to communicate with students. We had made significant use of social media to be able to relay those messaging, really reiterate to students how we wanted them to complete the census questionnaire. We were also cognizant of the fact that people under lockdown circumstances may not be able to get to their second home. For example, if they had a flat in London or a flat by the sea, which they would go to as a second residence, and we provided extra clarification on the need to complete a form for that second residence as well as the main address. And again, we made heavy use of social media to relay that message and remind people, and using comms channels which we recognised and already planned to be able to communicate to people who may have a second residence. Final slide from me. So as I say, overall, in terms of our approach, we placed a heavy emphasis on respondents completing the census based on their current circumstances. And that was very much based on being able to have results that we would be able to have confidence in. The suggestion that we may predict that new normal situation would present potential very significant inconsistencies and therefore error, and in terms of interpreting the data, the statistics that came out, that risk of doing that was too great to be able to go down that path. We don't want the census to be speculative about what the future may hold. In terms of how it worked, and we are still going through the process of processing census data, but in terms of the how respondents understood, we didn't get a huge amount of additional questions through our contact centre, which is always a good sign, and we had confidence that users had an understanding of or respondents had a good understanding of the questions because we tested them thoroughly. Final point from me, I think I would like to say, is that we recognise that those current circumstances potentially could be less relevant over the next decade. So we're doing additional work to understand how we can supplement census statistics, census data with other sources and integrate other sources to ensure that the currency is maintained and we're still able to use census data for the range of purposes into the future. And that was me.
Thank you very much. Okay. Thank you. We really appreciate, and then the illustrations that you presented are, I believe, quite very relevant to a number of our colleagues all over the world. That the adjustment really can be made, and not by changing the question itself, but providing additional explanations and guidance to the respondents. And then again, the fact that you had almost 90% online respondents is indeed something to be absolutely noted with interest. I don't think that you had initially expected such a huge online response rate. Thank you very much, John. And then we will listen to the next presentation, and then we will open the floor for questions and discussion on both presentations. Thank you again. The final presentation in this session is from UNSD. It will be delivered by Ms. Miriam Demitri, who is our interregional advisor for population and housing censuses. It elaborates on some of the adjustments and possible addition to instructions to address some of the phenomena that we have documenting during this census round. So, Miriam, please go ahead. The floor is yours.
Thank you, Surgeon. I see still the UK presentation. Can John stop sharing? Yes, thank you. Okay.
Sorry,
just a few. Thank you. I have enough sharing the presentation. It's coming. Okay. Hope you can see these slides. The first page is the in the title of my presentation is potential modification in census questionnaire. This presentation, you will see that we are actually referring here the existing recommendations for some topics. And we would like to highlight the importance of the using some questions to get an information for analyzing the impact of the pandemic. I would like to focus on two things in my presentations. First part will be dedicated to the mortality, fertility, and migration. And I would like to bring to your attention that what questions could be asked to get a really detailed information on the impact of the pandemic on mortality, fertility, or migration, if, of course, there is an impact. And the second part of my presentation, I will briefly discuss whether we need to modify questions, response categories, or some additional guidance, as just we heard from colleague from UK, and how this will impact the pandemic can have an impact on asking these questions or the understanding of the people of these questions. Let me first give you a brief information about the recent initiative established by the UNDESA and WHO. This is the Technical Advisory Group on COVID-19 Mortality Assessment. This group currently consists of the 5 working groups. One of them, the first one, is working on the global mortality estimates, including COVID-19. And the second group is working on use of surveys and censuses to fill data gaps. There are also other groups. So I've just listed here for your information. And I provided also the link for you. If you are interested in more information, you can get the concept notes for each of these groups. The first group, the objective of first group is to estimate the total number of deaths attributable to the COVID-19, and also assessing the impact of the pandemic on mortality by age, sex, and sex to identify the excess mortality attributable to COVID-19. So this group decided to use excess mortality to quantify the direct and indirect impacts of the pandemic. The main challenge that this group is facing to get really data on the number of deaths, considering that some countries, they don't have a registration system for death events, and that's the reason they are having a difficulty to produce estimates at the country level, and of course it affects the global estimation for the mortality. So the second group, this is the benefiting from surveys and censuses to fill data gaps on mortality. This group will focus on the methodological questions related to the gathering time-sensitive and reliable information of COVID-19 through the censuses and surveys for countries, of course, with unreliable civil registration and vital statistics system. This group will provide advice and recommendations to nation statistical office in 2 phases. In the first step, we are part of this group, so we will provide recommendations using the existing census and surveys to better measurement of mortality. And another one is the innovative methods to improve the mortality data collected through census surveys and how to integrate these data sources. Now I'm coming back to the census, the guidelines. As you know, we have a main guidelines is the principle and recommendations for population housing census revision 3. This guideline provides the definitions and also the essential features of censuses, and as you know, methodological approaches, and also provides the recommendations for census topics. divided in two groups, core and non-core topics. So the related to the mortality, there are several recommendations as a core topic. For estimating child mortality, there is a recommendations that the census should collect data on the children overborn, children surviving, and also the surviving status of the last child born alive. And another recommendations is related to the adult mortality is the question on the household deaths in the past 12 months for estimating the mortality. Again, this is the recommendations for countries that they don't have a reliable death register. So there is no recommendations on collecting the data on causes of death, except 2 cases. If country wish, they can collect data on the death due to the accident, violence, homicide, or suicide, or a couple of few more questions on capturing the data for estimating the maternal mortality. I'm not going to the detail. I just want to emphasize that the census is not the relevant source for collecting data on cause of death. We heard from some countries that they were thinking to include a question on the COVID-19 mortality. So there is no such a recommendations in the principal recommendations in the recent guidelines. Regarding the household deaths, we analyze while we were revising the principle and recommendations for the 2020 round censuses, we analyzed the country practices in the implementation of core topics. One of the topics that we analyze is the household deaths in the past 12 months period. So the suggested topics for this question is that for each deceased person, we should collect data on the name, age at death, sex, and also date of death in terms of months and years. This information also should be collected in the census. When we look at the country experiences in the previous round of censuses, we see that the about 50 countries actually asked this question in the last round. We are expecting maybe more countries would ask these questions in the current round. And about the more than actually 50% of the countries, you see the gap between the blue and orange bar, particularly in Africa and Asia. Many countries actually didn't ask a question on the date of death. So one of our suggestions for this round is that already it is suggested in the principle and recommendations. But since some countries still not collecting this data, it's important to get the information on the date of death to get a really the better data and they produce a good estimates for the mortality. Another suggestions that we would like to make, you may consider also the extending the reference period from 1 year to 2 years to capture enough information for the pandemic period. And also you may prefer to use a reference date covering 12 months or longer period instead of the reference period. And asking the questions, the last 12 months, you may give a reference date covering this period to capture the death events occurred during this period. And also, using these questions, it would be possible to estimate the excess mortality due to the pandemic through analyzing the differences between the total number of deaths during the pandemic and the estimated number of deaths before the pandemic. You may use maybe based on the previous censuses or the other mortality indicators. You may have some kind of estimated number for deaths before the pandemic. So this could be used to analyze the excess mortality from censuses. Also, that there are the issues that we need to consider. The reporting errors could occur because of the errors on the age of death date of deaths and also dissolution of some households after the death of the household member. Therefore, we may need to use indirect techniques to estimate the mortality. Another issue that we would like to bring to your attention is the questions related to the measuring the level and pattern of mortality. We don't know exactly whether the pandemic, conditions affected the level of mortality, but we would like to emphasize that based on of course the previous the experience of the countries, we are suggesting the specific type of questions for the fertility is already recommended in the international guidelines, principle and recommendation. We suggest that if you would like to collect data on the pattern and level of mortality through the censuses, please consider the use date of birth of last child born alive, which is the core topic. The other approach, the questions, the related question is the number of births in the past 12 months period. Actually, you see that some countries still, when you compare the two bars, the green and the red color bars, you see that still the number of countries use the second approach, the births in the past 12 months, to measure the fertility, the number of births, to collect the number of births. But it is important to consider the date of birth of last child born alive in order to reduce the omission, improve the quality, and also this type of question will allow estimation of fertility maybe last 2 years during the pandemic, and considering that the average duration of birth between 2 births would be maybe around 2 years. So this type of questions may give us information for the last 2 years. Another topic that we would like to discuss is the international migration. Again, the principle and recommendations recommends the several topics as a core for measuring the international migration: citizenship and country of birth, and also year or period of arrival to the country. These questions, the date of arrival in terms of the month and year, also would provide the detailed information for analyzing the impact of the pandemic. That's why we are suggesting that if you would like to get data on the immigrants, we are suggesting the questions on the date of arrival. In terms of internal migration, again, there are several recommendations as a core topic. One is the duration of residence and place of previous residence. Another suggested topic is the place of previous residence 1 year or 5 years ago. So in terms of the detail of the data, the first one, the duration of residence and place of previous residence, provide more detailed information. And this will allow also to better analyze the internal movement within the country during the period of the pandemic. So this will allow us to analyze the internal migration between the cities, rural and urban area. So this could be the opportunity. This round of census could be the opportunity to see the impact of the pandemic on the movement of the people within the country. Regarding the other topics, whether we need to modify the questions or not, I will just focus on the economic characteristics. We already heard from UK that they haven't modified the questions, but they provide the initial guidance to respond it for them to understand better the question. Because of the pandemic, it could be misunderstood. So then we look at some of the census questionnaires, and you may also consider not changes in the questions, but may include additional category. For example, for people who didn't work in a short time, For labor force, we just have a 1 year period as a reference period. 1 week, 7 days is the reference period. So if person didn't work the reference period because of the work interruption due to the pandemic, additional maybe category might be considered to reflect the current situation, such as the layoff or other situation of temporary work interruption because of the pandemic. Another category you might consider if there is a significant number of persons, if they haven't worked during this reference period, but they have an attachment with their workplace, you may consider also another category for unemployed on temporary layoff. These people, this is the people, they haven't worked, but they have either been given a day to return to work or expected to recall to their job within 3 or 6 months. These people, unlike the other unemployed people, those on the temporary layoff, they are not looking for a job. So therefore, they might be considered, and they haven't worked during this reference period. Therefore, you may consider another category for this group. Sorry, I can't change my slides. Let me, yeah, okay. I lost my slides. Let me share again. Okay, let me go to the slide. Yeah. Yes. This is the slides that I was going to move. The one topic, one more topic, I mean, the last topic actually, I would like to bring to your attention is the challenges in collecting the information on the place of usual residence, as we discussed in the previous session. The population housing census, as you know, provides the information for the reference period, reference time, census movement, as the snapshot of the entire population. Therefore, in general, the respondent, we're expecting the respondent provide the information about the current situation for the current circumstances. But challenges may arise to identify the place of usual residence of some people who, for example, who have moved several times and in and out of the household because of the coronavirus pandemic. And another group, we may think that there could be challenge to identify their place of residence is the students, and although they usually be away from their family home, but during the pandemic, if they live with their family, this could be a challenge to identify the usual residence. Also, the workers that had to move back to their home or family house from their usual place of works, this group may also need clear instructions to answer these questions. We recommend that this information on the place of residence should be collected as of the current circumstances. Yeah, finally, the few conclusions. Based on this discussion, we would like to suggest that the information for the deaths, migration, and births is suggested as a core topic, as suggested in the PNR. We should collect the information on the exact date of events rather than asking the questions about the occurrence of event during a reference period. It could be 1 year or maybe 2 years. If we collect data on exact date of events, this will help us to analyze the changes in the level and pattern of these events during the pandemic. In terms of the potential changes, it is important to communicate with the census users to understand what kind of information they need. If considering that the pandemic would affect some responses, but it's really critically important to communicate with the census users to understand what kind of information they need. And also, it's important to consider developing the comprehensive instructions and directions for both respondents and enumerators. And also, as emphasized before, we have to have a sufficient time to test any changes that we made in the questionnaire, even if we consider minor changes, or even if we add maybe the additional instructions to the enumerators or respondents. It's important to test these new additions or changes in the questionnaire. Thank you so much. This is the end of my presentation, and I will stop sharing now.
Thank you, Mariam. Thank you both UK and UNSD. There were some questions in the chat box already. One was for UK regarding second residencies, but I think that was already answered through the chat box. But the second question for UK in the chat box is related to what you mentioned are the uses of the censuses in building up a strong foundation for forthcoming statistical data collection activities and not only surveys. I would assume that you go beyond just the surveys. So would you mind then elaborating on this one a bit? And then I do have a question here. No, I do not have any other question in the chat box, but now I'm opening the floor for any follow-up comments or questions to either UK or UNSD. So the floor is now open. Please go ahead. I have Nozifo, South Africa. Please go ahead, Nozifo.
Thank you. My question is to Jonathan, but I'll just give a brief background using the UN presentation. So the UN presentation made some recommendations on how the questions can be adjusted to enable assessment of the COVID-19 impact. Now, I know that changing even the wording of the question without testing is risky. And testing is a process in itself that requires time. South Africa has just concluded a pilot and preparing for the main census. If South Africa were to make some changes based on these recommendations, it would be a challenge because of time. So Jonathan spoke about questionnaire testing done after some changes were made, if I understood him right. So what kind of tests were conducted? Were they field tests, or there was some kind of other test that one can consider in this case? Thank you.
Thank you very much. Thank you, Nozifo, South Africa. So the floor is open. Yes, Ian White. Ian, please go ahead.
John, and thank you everybody for the presentations today. And I'd just like to say hello to all my former colleagues that are watching there. Jonathan, thank you very much indeed for the coverage of the UK issue. This session was about how questions can be changed, or the impact of changing questions. And of course, what you have said, I think, reflects really the situation that is generally the case, and that it is very risky to change the wording of questions at a late stage to reflect current circumstances, no matter how important they are. And I think the experience of the UK is I think, typical in that it's often a very high risk activity to attempt to change the wording of questions. And what you have done, of course, is the best compromise. And that is where you have been able to change the instructions on the e-form. Of course, you couldn't do it on the paper form because they're printed already. You have done so. So I think this needs to be stressed, I think, for other countries, and maybe when this may well happen in the next round. It is always dangerous to try to reflect current circumstances by changing questions without them being thoroughly tested in the field. And I know that there is a temptation to add a question or add categories to a question at the last minute. And without assessing the response, effective response, this is very dangerous. Of course, there are other reasons why this might not be practicable, and it's not been mentioned so far, and that is most countries have to have their questions approved in legislation. And in many countries, that happens 2 or 3 years before the census, and it is not just often not practicable to change questions, or even, as Miriam was suggesting, changing response options to questions at the last minute, no matter how desirable it is. So I just wanted to thank you for your presentation, which I think made that clear. There was just one other thing I wanted to say, and that is with regards to the UK, and this is a query of mine. People may know that the UK ONS runs a very, very thorough epidemic survey to monitor the effect, separate from the census, monitoring the effect of the pandemic on the population. It's an ongoing survey, which is and has been used widely for the last year or so, and I think they need to be congratulated for doing this. There is great opportunity, I suppose, for linking the census and the survey data in the long run to assess the characteristics of people that have had and have not had COVID. And I'm hoping that the opportunity will be used to link these two great data sources so that whereas the census itself may not be able to measure the impact of COVID, combination with the COVID survey, the pandemic survey, might be able to do that. So that's just another thought. And just one further thought while I've got the floor, and thank you for your indulgence. And it's just picking up something that Miriam said very interestingly. She said that the census is a snapshot, and indeed it is. And you often ask questions about what is the current situation. But the one variable that is not a snapshot is usual residence. Usual residence is not a snapshot. There's a full definition of usual residence, and it is usually determined over a 12-month period. So I would just question the use. You can't measure usual residence by where people happen to be on census night. You have to have a definition of usual residence, which I suggest is not a snapshot. It's a usual condition and not a current condition. That's my only thoughts. I'd like to thank everybody today for some very interesting presentations. Thank you for your time.
Thank you, Ian. Thank you for your comments and suggestions. I have Fabiana from ECLAC, and then that would be our final query for today. We have to leave some time for our presenters to respond. Fabiana, please go ahead.
Thank you very much for this excellent presentation. Well, we are providing intensive technical assistance to Latin American countries in the preparation of their censuses, especially in defining the questionnaire. And we can see that we have a group of conservative countries that they try not to include a lot of innovation in this in their questionnaire due to the pandemic. But we are worried about that they are not that they don't having setbacks compared to the 2010 round censuses. So we strongly recommend this, not having setbacks compared to the 2010 round censuses, and others countries that are innovating despite the pandemic, and of course making tests. In this sense, we are strong recommend for this round to include a question in the fertility module. Well, first of all, I would like to say that most countries in our region include the date of birth of the last child. Marianne, we can see your graphic because I just see just 5 countries, but really most countries have the date of the birth of the last child. And we also recommend to include the date of birth of the first child. This is very important for our region. Some countries in the past included and function. We try to think not only in the pandemic, but also in the Agenda 2030. Related to migration, most countries ask about residence 5 years before the censuses. So we are recommending adding the question where the person lived in March 2020 in order to measure more structural changes in migratory patterns. And we totally agree with your recommendation about mortality. Moreover, there are some countries with really bad quality about their register. So these countries used to include the module of death in households and also the cause of death related to maternal mortality. So these countries also are thinking to include causes related to pandemic. That is a brief panorama of our region. Thank you very much.
Thank you, Fabiana. Thank you for your input. Really very valuable for us to understand the differences between different regions. I will now give the floor to Jonathan first, and then Mariam to address some of the comments. And there was this very specific question, Jonathan, regarding the build up on the census for the future. Go ahead, please.
Yes, I've got a few thoughts on that. So part of our understanding of the address frame that we use to as a basis for sending out census first contact, so where the addresses in which people live, is really fundamental to build on that for social surveys, because obviously we contact people through social surveys through their address. I think there's some important learning from some of the concepts that we've developed in the census, and some particularly around some of the new questions. And I'm particularly mindful of the categories that people use as their responses on new questions, like in the UK we have a sexual orientation question, a gender identity question. So those categories that we might want to use going forward for social surveys, which we wouldn't have had as such an in-depth understanding from, is quite valuable. In the UK, the move to an online survey was a real fundamental change from 2011 to 2021, and that understanding of how that online data collection process worked is something we're absolutely going to build on. The electronic questionnaire was based on an understanding that we develop it for both census and also for social surveys, so we've got some clear legacy there. I think in terms of the COVID impact, it has certainly helped us understand how we can best encourage response from certain communities where we may not need to make as much reference or weren't able to make face-to-face promotion. So kind of some of the things I was referring to in terms of online communication channels and promotion. I'm conscious that the COVID situation may have been something that will hopefully be a kind of one-off, and that we had very much a captive audience in terms of in England and Wales, that people were at home locked down for at least a large proportion of the collection period. So that understanding and unpicking that difference for census and then social surveys is important. I think it's also probably, as Ian was alluding to previously, the fact that it's a legal requirement for the census, and social surveys don't have that. And then I think finally, I would say our understanding of how effectively to follow up. So sending people reminder letters, knocking on doors, potentially other technologies we might be able to use that we didn't use in the census going forward, such as text reminders, etc. There's quite a lot of scope there. To go on to the other question about what kind of testing we did. So I put a link on the chat, which refers to a published paper we did that sets out how we tested census questions and how we developed the census questions. It's a mix of kind of behavioral insight analysis, focus groups, one-to-one interviews, cognitive testing, targeting particular groups that would answer the questions in certain ways, and then working those questions through with them and varieties of those questions to understand what the most effective is. I should mention we've got a census quality survey that we've just run after the census that resamples people as not a coverage survey, but basically asks the same questions in a different mode so we can understand how well people understood those questions. Ian's point, absolutely, there is a huge opportunity to be able to use census alongside other data. I should always say in that question, answering that question, that will be done under the strict conditions that we have for data linkage and the kind of 5 Safes initiative that we have in the UK about a safe project, safe researchers, etc., etc. But absolutely, that's a really fundamentally important thing to running a census in a pandemic, the insight that it would provide. I've gone quite quickly through that. Is that okay? There's another question on the chat as well. Do you want to take that?
I didn't see any.
How would you distinguish those who are affected by the pandemic and those who were not? I'm not sure the answer to that at the moment. That will be part of our processing and understanding of the data that we collected. And if we can produce new outputs as a basis of that, based on that, some of that logic, that would be interesting. We haven't really got through that to that point yet, I think I would say.
Thank you. Thank you, Jonathan. Thank you for this. Miriam, briefly, please.
Yeah, just a few points regarding the contribution from Fabia. Yes, actually, the Latin American countries may have a better the data quality, but some other countries still maybe need to consider the questions type that we suggested. I just want to really emphasize that what we are suggesting here is not for countries that they will go immediately the census enumeration. If they have still time to make some minor changes, maybe adding one category, but they have to test, of course. So considering that the many countries now postponed their census next year, late next year, even 2023, that's the reason we want that we need to maybe re-emphasize some recommendations that would help to analyze the impact of the pandemic. So if they have enough time to test all the changes, like for example, they ask a question on household debts, but if there is no questions on date of the debt, then this could be added. That's our objective to provide these recommendations. Thank you. Yeah.
Thank you very much, Miriam. So I thank all the presenters and all the participants. I believe that we have a good start of this expert group meeting. I think that we are just opening the discussion for the following 3 days. And let me just, in terms of logistics, again remind that we will start tomorrow at 8 o'clock. Sharp. Then at 7:30 we will be open for the presenters to test their connections, and tomorrow under session number 4 we have the presentations from Australia, China, Chile, Croatia, India, Italy, Portugal, South Africa, Zambia, and possibly Saudi Arabia. So please feel free to log in static at 7:30 New York time to test the connections so that we can go smoothly throughout the session number 4. Again, thank you very much. We will be posting the recordings and we will be posting the presentations later today, New York time. Should you again have any objections to posting, then please let us know in the next half an hour. Just send an email. Also, if you have any questions that remained unanswered, that when you digest the proceedings of this session, please don't hesitate sending the questions to us, either to the Census program at un.org, and then we will channel the questions to the presenters and make sure that all the questions are addressed. So with further ado, again, thank you very much. We will touch bases tomorrow, 8 o'clock New York time, and have the good rest of the day or the good start of the night, depending when you are. Thank you, and until tomorrow. Goodbye.
Thank you. Goodbye.